Okay. Welcome to the call. This is the Tuesday Doctor's Call on September 4th, 2018. Each and every Tuesday we have a doctor's call at noon Eastern Time. And what we do is have a discussion with Dr. Kurt Fisnick, who is our in-house professional. I'm Andrea from Michigan. I host the call. And we discuss various health topics. Dr. Kurt brings his wealth of knowledge to us to share information about these topics and then also some natural health solutions that you could participate with. So welcome to the call, Dr. Kurt.
Hey, welcome to the call, Andrea. How are you doing today?
I'm great. I hear we're going to talk about arthritis today.
We're going to talk about arthritis. Yeah, you know, it seems like with the cooler weather, people tend to have a little bit more achiness in their joints. I'm starting to hear people complaining about it as the temperatures are dropping. So as I was driving home yesterday, I thought, well, that would be a great topic just to talk about today.
Yeah, now that our 100-degree weather is over, it's been raining just about nonstop here in Michigan, so it's probably a good topic for this area.
Yeah, it really is. And you know, it affects a lot of people. And they say that I think it's close to 80% of people, 80% of adults are going to have some kind of chronic joint pain in their lifetime, 80%.
And could you give us like some generalized ideas of what causes arthritis?
Well, I think that the type of arthritis that most people think about when you talk about arthritis, most people are probably thinking about the wear and tear type of arthritis. It's just like on your car, you know, if you drive your car long enough, you're going to wear the tires out. And that's what happens in your body is you basically you wear the tires out, the joints, the cartilage, you know, the soft tissue between the bones. Eventually, it starts to get wear and tear on it, and that's probably, you know, what I'm going to say is what most people think about when they think about arthritis. And then, you know, I mean, and that's just for mileage, you know, over time it wears out. But also, if you've got a job that's repetitive motion, let's say you're working on a factory and you're having to twist one direction all the time to put things together, machinery or whatever. I think that, you know, that's another cause of degenerative arthritis. Again, you know, wear and tear.
You know, there's a couple of terms that are connected to arthritis out there that people, you know, use, and maybe our listeners today don't understand the difference between rheumatoid arthritis and osteoarthritis. Could you explain that?
Yeah, so that's what I was going to say. Next is that, you know, that probably, you know, in today's world, we're probably seeing maybe as much rheumatoid, or let's call it inflammatory arthritis, because rheumatoid kind of limits you to a type of arthritis where there's a rheumatoid factor. But let's talk about inflammatory arthritis. And so the difference between the inflammatory arthritis or rheumatoid arthritis and osteoarthritis is that there's an autoimmune component to it. And what that means is that something, and usually an external factor, it's triggered your body to look at you, and in this case, to look at the joint, and thinks that the joint is abnormal, thinks that the joint isn't part of you. And so then what happens is your immune system starts to attack it, and also it builds up antibodies that attack you and attack your joint, and that's what causes the inflammation. And there's various forms, like lupus is a form of inflammatory arthritis. It falls in the rheumatoid category. Then you have psoriatic, which is, you know, related to psoriasis, and gout kind of fits in that same category. So yeah, there's various forms.
So you mentioned external factors, so we could consider that toxins maybe, or a substance that is maybe not so natural in the food chain that we're intaking would be maybe some triggers for that.
Yeah, and I don't know so much, you know, uh, if it's really like a toxin, your body's viewing it as abnormal, as a foreign invader. But I don't even know if I want to say it's a toxin because, like gluten, for example, gluten really isn't a toxin. It's a natural protein found in wheat and barley and that. But so what happens is that for some reason your body just looks at the gluten as being abnormal. So gluten looks like a protein in your body, and so your immune system attacks the gluten, and then what it does, it cross-references, and in the computer system in your body, let's call it a computer, in that computer system, it cross-references as improperly, and so then what it does is it starts to attack your body because your body looks like gluten. Another one would be dairy, and in dairy, there's different types of casein. There's casein A1 and casein A2, and in the A2 category, it's the type of casein that's found like in goat's milk, and it's found in zebu cattle. It's found in certain types of cattle, but it's more what they call the ancient cattle, the cattle that they talk about in the Bible. And for some reason, your body doesn't look at that casein as being abnormal. But what it does when you have the casein A1, which is from modern day cattle, hybrid cattle, the immune system views that as abnormal. And then the same thing as the gluten, it attacks any of the proteins in your body that look like the casein A1, and then that causes the inflammation. It causes everything go on. But part of it that they're saying right now is that with this, with the Roundup, with the glyphosate in the wheat, for example, what happens is the glyphosate makes the gluten look abnormal. So maybe it's not even the gluten that's triggering it. Maybe it's the gluten contaminated with the glyphosate, and so there's some research being done on that right now. That's a theory that they're saying, because right now, what is there, like 85, 86 different named autoimmune disorders?
Right. That's pretty amazing. And anyone can go out on YouTube or Google and do a search about foods containing glyphosate, and try to avoid them. I have a testimony here that we recorded back in February 2018 of someone who had an experience with arthritis and one of our products. Would you like me to play that now, or do you have something?
Yeah, let's play that. I'd like to hear it, because I remember she had just quite an amazing experience using the Sisel product. So yeah, if you'd like to play that testimonial.
Okay, here we go.
What I'd like to do, I'm going to go out to Margaret Johnson. Here's another great testimonial that we have. Margaret, if you could tell a little bit about what you're seeing, what you're finding.
Sure. I started taking the H pill October 4th, and within a few weeks I started noticing a big difference in my skin and the appearance. And then I started noticing the pain in my back. I've had degenerative disc disease for years, and my back in 2016, a doctor in Walla Walla, Washington, created a whole procedure to fix my lower back, and figured I would always have pain, and I always had a lot of arthritis in my back. And over the course of time, it was kind of interesting over the last few months. It was like it kind of took me back through the memory of the pain in my back before surgery and then after the surgery, and then it disappeared. So I became curious, and I had some x-rays done on my back. And the radiologist said that she can't detect any arthritis in my back whatsoever anymore, and there's no pain. So that's been a huge blessing, you know. It's just amazing to go from the pain I was in through the years, and then after the surgery was a success, but I still had a lot of residual pain that he figured I'd have to just deal with in my life from now on, and it's gone. I have no pain in my back whatsoever.
Wow. And not only is it the pain that's gone, but from what I was hearing, it's actually changing on radiographs, on the x-rays.
Yes. Before I had a lot of osteoarthritis, which a lot of us have, and then I had a spot above the surgery in the thoracic area that they were considering having to go in and fix eventually in the next couple of years. He said he can't find any of it. He said there's no sign of any arthritis in my back or my shoulders. I had shoulder surgery too in both shoulders, and he said there's no arthritis anywhere. It's gone.
Wow. Wow. And what did he say? What did your surgeon say about that?
Well, he was pretty astounded. He you know, I talked to him on the phone, and he said it's pretty amazing. And he says, what have you been doing? I started telling him about the H pill. So beginning of April, I have an appointment to go over and talk to him about the H pill. He said he's really interested in finding out more about it. And he said he couldn't release my x-rays from my back because of the procedure. He hasn't finished his article about the procedure that he created, so I can't use the x-rays yet.
Really?
Yeah.
Huh, that's interesting.
Did he pay for him? Did he pay for him, or did you?
So there was the testimony from Margaret Johnson.
Isn't that crazy? And Andrea, what products was she using back then? Was it just the H pill?
It was really early. She said she started it October 4th, and we did this recording the first part of February, I believe. So she'd only been on the H pill for 3 months and probably did a double dose because I believe she's in her late 60s or early 70s.
So in 90 days,
Mm-hmm.
it erased the history of the arthritis, even on x-ray.
Yeah, and you know, she had a lot of x-rays previous to that, so she had the record of it.
Wow. I mean, talk about a documented case there. That's huge. As President Trump would say. Huge.
Huge. Yeah, so, you know, we do work with a company that produces non-toxic and very, very effective products. Some of the cutting edge research has gone into the formulations of our anti-aging products. And one of our anti-aging products called the H pill is what Margaret was taking. But I think you have a few other products that you want to share today, Doc, about what people can use to help fight the effects of arthritis.
Yeah. Well, let's talk a little bit about the products that we have, Andrea. Of course, you know, the H pill. After that testimonial, everybody on that's listening to this recording, everybody that's listening to the call, they want to know, well, how could a nutritional product do that?
Right.
Well, the H pill, what it has in it, it's got nicotinamide riboside. It's got a number of other ingredients that, based on science, if you look up the science, and again, it's not science on our product. We can't make any medical claims on our product. But when you look at the science on the individual ingredients, the individual extracts, what the science shows is that the ingredients do support and work with your body's own repair system that's operated through the stem cells. And so what it does is that it stimulates these stem cells to go back to work, to come out of hibernation. And I'm just going to use the word hibernation rather than saying senescence, because a lot of people don't understand the word senescence. But your stem cells, after a period of time, they just kind of go to sleep. And so what they found with nicotinamide riboside and some of the other ingredients, nicotinaminic acid and just niacin itself, will pull these stem cells out of this sleep, and they go back to work. And when you look at it, you know, somebody that's 10, 20 years old, they've got one stem cell for every 10,000 regular cells in their body. But when you get to be, you know, 50 years old, then you only have one stem cell for every, you know, 500,000 regular cells. So it's decreased that much. And then when you get to be, you know, like Margaret's age, you said she's in her, you know, like 70. When you get to be that age, you have one stem cell for every 2 million regular cells. And so, I mean, think about that, folks. One stem cell for every 2 million cells. And so these cells, they just, I mean, there's just not enough of them to really go in and repair all the damage. And when you get to be 60, 70 years old, of course, that's the time of your life when you've probably got the most damage and you have the least amount of stem cells. So anything that you can do that will go in and stimulate the stem cells to kind of come back to life, to go back to work, it's going to improve things. And that's what Margaret noticed. Now, what an awesome testimonial. Thanks for bringing that to us today. And, you know, then the other product that I talked about here 2 weeks ago on a call that's I think is so important with when we're talking about arthritis is fucoidan. And where the fucoidan really fits in is that some of the new science is that they found that it activates, this helps to activate the stem cells, but more importantly, it mobilizes the stem cells. So let's say that, you know, I mean, I have a bad right leg because of my motorcycle wreck. And so how do my stem cells know to go to my right leg versus go to my left leg? And that's where they found that the fucoidan is so important, because the fucoidan tells your stem cells where to go. It tells your stem cells what joints to go to in order to repair the joint. And the other thing about fucoidan is that they found that it's a really good natural anti-inflammatory, and so it gets rid of the inflammation that's triggered by arthritis. The other thing that it does is that it's highly sulfonated, and when you're talking about a sulfonated product, sulfonation is like one of the steps that your body needs in order to repair a joint after an injury. And we don't in our normal everyday diet, in the normal, let's call it the standard American diet, we don't have a lot of vegetables anymore that contain the right amount of organic sulfur. And so you've heard of people using products like glucosamine sulfate, right? Sulfate, think about that. And then we have MSM, or methyl sulfonylmethane, which is a sulfur group. And then you have like even shark cartilage and aloe vera, right? Those are all sulfonated products, and so they kind of fall in that same category as the Sisel fucoidan, but the fucoidan has more of these natural sulfur molecules, and so it's going to work that much better. And I've heard some people say like 3,000% better, which is, again, that's huge. And is it 3,000%? Is it 2,500%? You know, I really can't answer that, you know, because there's no exact numbers on it. But just imagine, what if it's only 300% better than anything else on the market? Again, you know, that's going to be a really, really good factor when it comes to healing your body. And then and so that fucoidan is really, really good. And the other one is the Eternity, and Eternity is a a product, another liquid nutritional that we have at Sisel, and it's got something that the ingredient, it's called resveratrol. And what resveratrol does is resveratrol is a extract from grape seed, and they found that resveratrol repairs or activates what they call the SIRT1 gene, the sirtuin gene, number one. And what that gene is for is for repairing damaged DNA. And every day our DNA is under attack, and so with the resveratrol, it's been shown to activate that SIRT1 gene, and it repairs the DNA. And if you can repair the DNA, you're gonna increase the healing ability. If we go back on this call, if you go on to some of our recordings back, I think about 3 years ago, I believe it was a call that we did in February 3 years ago, back in 2015. We had a lady out of South Dakota. I think she was right around 75, 76 years old, and she was loaded with rheumatoid arthritis, and she used Eternity is the only product that she used, and she took a double dose. She took a dose in the morning, and she took a dose in the evening, and all of her inflammation from the rheumatoid arthritis in her fingers, it totally went away. And I saw it. I mean, her fingers were all back to normal size. And so again, you start thinking about repairing that damaged DNA. It's going to have a great effect on the body, and repairing and healing and that. And then we start talking about some of the maybe I'm going to say more simple products, like the omegas, the Super Omega. Super Omega has omega-3, and in omega-3, there's a specific fat. It's called EPA, and EPA is a fat that it gets rid of inflammation, and not just in the joints, but so all over the body. So in the cardiovascular system, in the brain, in the nervous system, in the joints, and so the Super Omega is another really excellent product. And then a product that Tom formulated specifically for arthritis is called Renovator. And Renovator, without getting into all the ingredients in there, but what Renovator has in it, it's got more of that MSM that I talked about, and the glucosamine. It's got some ingredients from some algae. It's got turmeric, which gets rid of inflammation. And but with the ingredients that are found in the Renovator product, what it does is it stimulates them. And again, we can't say it about the product, but we can talk about the ingredients. The science on the ingredients shows that these ingredients stimulate the body to go back and repair the joints. And so where there's joint destruction, it goes in there and it causes the joint to rebuild. And so another great product to take if you have arthritis. So those are a list of the products that I recommend when somebody has arthritis. Like Andrea was saying in the beginning of the call, she was talking about a toxicity, and one of the things that's bad about toxins is that toxins can actually block your body from repair. Like arsenic, for example, just talk about one ingredient, one toxin. Arsenic will block zinc from getting into the zinc finger proteins, and it'll stop healing. And so Body Shield is designed to pull those toxins out. But the cool thing about Body Shield is it actually has something in it called fulvic acid, not folic acid. Fulvic, F-U-L-V-I-C, fulvic acid. And what the fulvic acid does is it is it pulls vitamins and nutrients into the cell at the same time that it pulls the toxins out. And so another great product to have if you've got arthritis. So I think that's a list of everything that we got, Andrea.
Fabulous. Great information, Doc. We appreciate that. We are at the bottom of the hour, so we're going to wrap this up. Just so anyone who's listening to this knows, if you were invited to this call by a friend, get back with them regarding any products. They can help you with more information and how to place an order if that's what you decide to do. Also, all of the doctor calls that we listen to on Tuesdays are recorded, and they are stored on Dr. Kurt's YouTube channel, Sisel World Team. So if you keep this call in mind and you run into a friend who has arthritis or something, you can always go to Sisel World Team, pull up today's call and share it with them, just so that you know that that resource is available for you. Have a great day, everyone. Enjoy.
Thanks, Andrea. Thanks, everyone. You off?